chips are in here. Okay. Hi, I'm Alex. I'm going to be your nurse today. I'm going to start by performing hand hygiene, closing the curtain for privacy, raising the bed to a working height, and then can I check your wristband and can you tell me your name and date of birth?
Margot Jones, 5/29/2002.
Okay, perfect, thank you. Today I'm just going to perform a head-to-toe assessment on you if that's alright.
Yes.
I'm going to ask you a few questions. Could you tell me what year it is?
2022.
And then could you tell me where we are?
A hospital.
And then what brings you in today?
My annual doctor's checkup.
Okay, perfect. So while I was talking to the patient, I noticed that her hygiene is grooming. She's well kept. Her speech is perfect. She did not appear to be in any kind of distress. Her breathing was unlabored and she was on room air as well. I'm going to go ahead and start by just looking at your head, if that's all right. It looks symmetrical, and then there is no masses that I can feel. Now I'm going to look in your ears and nose for any redness or drainage. Until your head. Thank you, in your nose. Okay, perfect. There is no redness or drainage in her ears or nose. And then looking at her lips, there is no cyanosis, and her skin color and her lip color seems appropriate for her ethnicity. Now I'm going to do a little eye exam on you, if that's all right. I'm going to pull down your eyelids so you can just look straight. Oh, sorry. Okay, look up. Okay, so her sclera and conjunctiva is china white. Now I'm going to ask you to look straight ahead at that wall, and I'm going to put a light in front of your eyes, but don't look at the light, just keep looking straight. So measuring her pupils, they're about a 5, and now I'm going to put the light across. Okay, and her pupils went down to about a 2, so her pupillary light reflex is intact. Now I'm going to have you look straight ahead again, and then when I tell you, look at my finger. Look at my finger. Okay, and her eyes accommodated for that as well. And now just follow my finger everywhere I put it, okay? Okay, perfect. She was able to follow all 6 cardinal gazes. Now I'm going to look at your neck. If I was in the hospital, I'd raise the bed to a 30 to 45 degree angle. I'm going to check for JVD on both sides, and there is none noted. And now I'm going to feel your carotid pulse. And it is 2+ bilaterally. Now I'm going to look at your arms, so you can just lay them out straight. I'm going to feel for the temperature and moisture. Her arms are dry and warm. Now I'm going to check the brachial pulse on both sides. And they are 2+ bilaterally, and her radial pulse on both sides. And it's also 2+ bilaterally. Now I'm going to feel on her collarbone for a skin turgor. And there is no tenting notice. And then can you squeeze my 2 fingers as hard as you can? Okay, perfect. Her muscle strength is 5+. And then I'm going to check her bony prominences for any ulcers, and it doesn't look like there is any. Now I'm going to move to her legs. Ideally she would be wearing shorts, but I'm going to feel for her temperature and moisture, and her legs feel dry and warm as well. Oh, and also on the fingers I'm going to check for your capillary refill, sorry. And her capillary refill is less than 3 seconds on both sides. With her legs, I'm going to ask you to press down on my hands with your feet as hard as you can. And then up against my hands. Okay, perfect. Her muscle strength is also 5+. I'm going to check for any swelling or edema. And at 0, there is none noted. I'm going to check her hips and all the other bony prominences for any ulcers, and there is none. Now I'm going to go ahead and listen to your heart. If you could sit up, please. I'm going to listen to all 5 locations, starting at the right sternal border, 2nd intercostal space. And this is aortic. And now I'm going to pulmonic, which is 2nd intercostal space, left sternal border. And now the Erb's point, which is 3rd intercostal space, left sternal border. And now tricuspid, which is 4th intercostal space, left sternal border. And then mitral, which is fifth intercostal space, left midclavicular line. Okay, all of her heart sounds were regular in rhythm, and now I'm going to take her apical pulse for a full minute. You can just breathe normally. Okay, her apical heart rate was 72, and then while listening to her heart sounds, S1 was louder at the apex and S2 was louder at the base. Now I'm going to listen to your lung sounds anteriorly. And if you can just take deep breaths. Okay, her lung sounds anteriorly had no adventitious sounds. She had normal lung sounds, and now if you can flip to the back, I'm gonna check for her symmetry on the back. If you can just take a deep breath. And it looks symmetrical. And now I'm gonna listen to the lung sounds on the posterior side. Deep breaths. And her lung sounds on the posterior side also sounded clear. There was no adventitious sounds. You can turn back around. And then also looking at her back, there was no sign of ulcers or the skin breaking down. And then on the front, I forgot to check for the symmetry, so if you can just take a big deep breath. Okay, perfect. And it also looks symmetrical. You can lay back down. Now I'm going to do an assessment of her abdomen. Do you have any tenderness or anything right now?
No.
No? Okay. I'm going to start with auscultation in the right lower quadrant. Okay, her bowel sounds were normal active, and now I'm going to do some light palpation. Just tell me if you feel any tenderness. Was there any tenderness? No? Okay, perfect. And then rating her on the Glasgow Coma scale, she is a 15. And then the Braden scale is a 23. And then for the Morse code, she is a 0. Is there anything else I can do for you today?
No, thank you.
Okay, I'm going to raise or lower the bed back for her. Bring up the side rails, make sure she has her no-slip socks on. Make sure the call light is within reach. Perform my hand hygiene. And then your call light if you need me again later.
Thanks.
Thanks.